This is Rachel Leonard, and this is speech number 3. This is my audience. Go. Today I'm going to present a speech, a persuasive speech about sudden cardiac screening. I feel strongly that a pre-participation exam should include cardiovascular screenings. Sudden cardiac arrest kills more than 350,000 Americans per year, according to the Heart Rhythm Society. In 1996, Lisa Sahlberg founded the Hypertrophic Cardiomyopathy Association, which offers the latest in science, patient resources, advocacy, and free surveys to help you tell you if you or your child might be at risk for sudden cardiac arrest. In 2012, New Jersey legislation passed Janet's Law. This is named after an 11-year-old girl who collapsed and died from sudden cardiac arrest. This law mandates that schools must have an emergency plan for responding to sudden cardiac arrest, and that school officials and coaches be trained to use the automated external defibrillators. New Jersey also passed a law requiring pre-participation cardiac assessment exams for all student athletes. I feel that both of these laws are great. People don't realize how important these things are. I was a student athlete all the years that I was in school, and I always had my yearly physicals. I was a walking time bomb and never knew it until I was in my 30s. 2 heart surgeries later and an internal pacemaker and defibrillator, I now know how important these things are. I had no previous history or family history, but I had a severe case, and it was very dangerous for me. I immediately had my children checked because they too could have it, and sudden cardiac arrest with no defibrillator results in death. Athletes are not the only ones at risk. About 80% of kids who die under age 24 are not athletes. Hypertrophic cardiomyopathy affects up to 1.5 million Americans. The disease causes the heart muscles, particularly the ventricles, to become abnormally thick, which creates a narrowing that blocks and reduces blood flow to the aorta. Hypertrophic cardiomyopathy ranks as the leading cause of sudden cardiac death in people under the age of 30. Tragically, a common initial symptom of hypertrophic cardiomyopathy can be a sudden collapse that is often fatal, without immediate treatment such as CPR or shock from a defibrillator. Overall, an estimated 95% of people who go into sudden cardiac arrest die before they reach the hospital or other source of emergency help. Sudden cardiac arrest kills more Sudden cardiac death kills more Americans each year than do breast cancer, lung cancer, stroke, or AIDS. In Italy, the law requires that all student athletes be screened by an electrocardiogram before they're allowed to participate in sports. But in the U.S., this screening is still very controversial due to cost. Given that this test could save lives by identifying kids at risk, wouldn't you recommend that the test be given? If an abnormality were found, additional testing could be ordered. We will pay $75 to $100 for our kids to play ball, but don't want to spend an extra $50 or more every 3 to 5 years to ensure that their heart is okay. A heart attack and sudden cardiac arrest are 2 different things. Many people think that they are the same. A heart attack is when blood flow to the heart is blocked. Sudden cardiac arrest is when the heart malfunctions and suddenly stops beating. A heart attack is a circulation problem. Sudden cardiac arrest is an electrical problem. Cardiac arrest, suddenly and often without warning, can occur after a heart attack or during recovery. Fast actions and proper equipment can help save lives when sudden cardiac arrest occurs. Cardiac arrest is reversible in most victims if treated within a few minutes. If no external defibrillator is available, hands-on CPR can save the victim. The American Heart Association states that doing CPR to the beat of the classic disco song, Staying Alive, you can double or even triple the victim's chance of survival. That's a pretty neat way to remember the beat of CPR. People usually think that it won't happen. People usually think that they can't have or won't have heart problems. They associate that with older people. Unfortunately, sudden death or sudden cardiac arrest in people under age 35 is often due to or hidden by abnormal heart abnormalities. When these sudden deaths occur, it's often during physical activity. Millions of elementary school, high school, and college athletes compete each year without incidents. The cause of sudden cardiac death in young people vary for a variety of reasons. Something causes the heart to beat out of control. This abnormal heart rhythm is called ventricular fibrillation. Other causes of sudden cardiac arrest in young people are structural abnormalities of the heart and other heart muscle abnormalities. Some of the red flags and symptoms that should signal a problem are unexplained fainting, a family history of sudden cardiac arrest, shortness of breath, or chest pain. The pre-participation exam is used to detect cardiovascular disorders known to cause sudden cardiac arrest in athletes. Studies show that the traditional history and physical-based exam has a limited sensitivity and does not detect the majority of athletes with at-risk conditions. The main goal of having a cardiovascular screening is to maximize the safety of our children and athletes. Although I've had my children checked and they are clear, it still terrifies me sometimes to think, what if? In a recent study by the American Academy of Pediatrics, it estimates that 2,000 people under the age of 25 die from sudden cardiac arrest in the U.S. every year. Only the sensational cases usually make the headlines. Here is an example. In March of 2012, star soccer player in England, Fabrice Mamba, nearly died after suddenly collapsing in cardiac arrest on the field during a televised game. An automated external defibrillator saved his life. The problem is those who are at risk are hard to spot sometimes. Warning signs are rare, and they are often dismissed by young people. That's why I feel that starting even during well-child exams and during regular pre-participation exams that cardiovascular screenings should be included. Please consider all the information that I have given you and don't think, well, it won't happen to me or my family. It could. Better to be safe than sorry. Aren't our families and our loved ones important enough to make sure that they are heart healthy? I know that mine are to me. Please spread the word about sudden cardiac arrest so that we can make more people aware and can save more lives.